so much for having me. I'm very excited to be here, and I'm going to speak from a little bit of a different perspective than the previous two speakers. I'm going to speak from the perspective of a community organizer about the need for healthcare reform. I've actually been working as a community organizer for almost 10 years now, and throughout my career I have talked with a lot of folks, and throughout the Obama campaign on which I worked, and now my new role with Organizing for America, I've talked with a lot of folks about the need for healthcare. In fact, it's been a consistent theme in all of the organizing work that I have done, and I've heard many stories of folks who have gone without care and what that can mean year after year after year. Here in Virginia, thousands of folks have submitted their stories, their individual stories, about their own need for healthcare to our website. And as we read through them, the stories are heartbreaking. And they put flesh and bone on the statistics that Dr. Joseph put forward. We aren't delivering health care to folks who are insured or uninsured properly in this country right now. And as the congressman indicated, we may not be able to make that leap to single payer this year, but we can move forward. Too many folks have been waiting for too long for us not to think about how we can work together to move forward on healthcare reform this year. We have a very unique window of opportunity. So what I would invite folks to think about is not just about who pays, but also about what we're paying for when we pay for healthcare, and about that need for investment in primary care. Right now, our Medicare system isn't perfect. In fact, 50% of people who get care through Medicare come back to their physician within a month. It's sort of a revolving door because they don't get to have that conversation that Dr. Joseph mentioned. They don't get to get thorough counseling about all of the elements of what they require as an individual, as a full person with health care needs. And we need to encourage that thorough primary care. We need to reward value, not just volume, in our system. President Obama wants to make that investment in primary care, and he also wants to invest in healthcare information technology so that we can be more efficient. And to deal with that coding problem that Dr. Joseph also mentioned, where physicians are again incentivized not to provide that thorough primary care. We need to change that system and really dig in and make sure that we fix what we can fix now, build on what works, and work toward further improvement in the future. So Medicare does need to change the way it pays for evaluation and coding, and we also need to make sure that all Americans have access to affordable health care. In my own life, I've been a person who has had 4 jobs at the same time once, putting myself through school, 2 waitressing jobs, another job teaching chemistry to young children in a gifted and talented program, and a 4th job as a personal trainer, and was going to school at the same time. And at that time, I didn't have health care myself. I had a skin cancer lesion that had to go untreated for 2 years. I wasn't able to go to the doctor and even see what it was, and even find out what it was. So I just, sort of in my quiet moments would have this pit in my stomach, wondering what that was growing on my back, waiting for a moment when I would have a full-time job that would provide health care. And I was lucky. When I did find out what it was able to be removed, and I was able to move on and be healthy. But in my work, I've talked with other people who haven't been as lucky. And some of those people have been people who have been insured. I spoke with a young woman just this weekend when we did our Healthcare Day of Service, which was a national day. We had over 55 events here in Virginia where folks pitched in on service events having to do with healthcare. And one woman who organized an event said that she organized that event because when she began a job specifically for the purpose of accessing healthcare, sort of a manual labor job, not her dream job, but something that provided health care. So she thought that she would be safe, and her family members who also worked at that job would be safe. She then went with her health insurance to get care and was turned away because no doctors in her area took that health insurance. So this is a problem that is costing us more and more, and we're receiving as a country less and less as we continue to pay more. So what I would invite folks to do is, let's think about how we can work together on this to make sure that we do move forward in this session. I think that none of us want to be having this same conversation a year from now. None of us want to have other people that we know in our community whose healthcare story we can point to as another additional illustration of why we need care. We want to start hearing some success stories. We want to hear about how we did move forward for the first time in 60 years, how we were able to work together, and that even if we don't agree on everything, we're able to agree on enough that we can start to move forward and push this conversation. So as I look out at you, I see a lot of thoughtful, intelligent, energized people, and I also see empty seats next to you. So I think that we ought to think about, as we move forward, how can we fill those seats and in what venues? Who isn't in this room that could be in this room to work with us? How can we organize folks around the principles of increasing access, maintaining choice, and increasing affordability, and increasing quality, making that primary care happen in this country and in this Commonwealth? Let's think about who we can talk to. Whose story can we gather? Who will stand with us on those principles? And what can we do with that conversation? How can we speak with our elected officials? And how can we speak with each other as a community? It's my hope to work with a lot of you in the Organizing for America will be a catalyst for that conversation to continue in Virginia. But you also all have personal networks that you can think about as well. And you have family members and you have coworkers. So I would invite you to keep the conversation going. Keep talking about the public option, keep talking about where you want to go ultimately with healthcare reform, and make sure that we make it happen in this legislative session so that we're not having this conversation 12 months from now, but instead we're talking about what's the next step after this huge victory that we worked on together. So thank you.